Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and joining us today is Fairmont Medical Center Chief Administrative Officer, Stephen Pribyl. Steve, thanks for joining us today on Speaking of Health.
It's a pleasure to be here, Jason, and I hope everyone is enjoying the holiday season.
Well, today we're taking a look back at the past year at Fairmont Medical Center, Mayo Health System. And in 2009, one of the more notable changes was in the medical center's leadership with Dr. Philip Vuccolo taking over as president and CEO. Talk a little bit about that.
Dr. Vuccolo joined us as a practicing general surgeon and vascular surgeon back in early 2008. And then at the point in time when we were searching for a new physician chief executive officer, he applied for the position, went through a selection process, and our board selected Dr. Vuccolo as our new leader, physician leader. He brings to Fairmont Medical Center a passion and vision for a broad range of areas and issues. He has a background actually in working with physician groups and hospitals both in New York and other places. His primary focus that he brought to us, his number one concern or mission, is to ensure highest quality of care for our patients and to serve the communities. Over the last 12 months, Dr. Vuccolo, working with our board of directors and senior leadership, we actually have reframed our vision and mission and are focused this year on specifically patient safety, quality of service, and quality itself and service that we provide. We're evidence of our focus on educating the community. So we've launched the very aggressive Speaking of Health series, both with the TV program as well as the newspaper articles and the forums that we host on campus every month with another physician or a different physician each month talking on a topical issue. We also have increased our services. We've expanded our hours in some places. We have a Tuesday evening clinic, and we look forward to continuing that focus or vision going into 2010.
Well, Steve, Fairmont Medical Center mirrors the Mayo model of care, which is the needs of the patient come first. And there were several new ideas put into place this year at Fairmont Medical Center that really show that. And you talked a little bit about some of those. And one of the things I really want to talk about is valet parking. You have valet parking now at a medical center, which is something that I would think would be a little unusual, but patients have been very pleased, right?
I tell you what, it was late in coming. Actually, I wish we had started this years ago, but for our population, particularly those that may be elderly or wheelchair bound, to be able to drive up to the front door of the clinic, have someone assist in moving patients or family members, and then in fact park the cars, has really been a great service and been a huge success. We hear lots of compliments from the community in that respect. Something else that we've done in the clinic area that has reaped or provided many benefits is we've decentralized our scheduling process. It used to be that an individual wishing to make an appointment at the medical center would call one number, and whomever might be available to answer the phone would answer the phone. And so you could be talking to one of 20 different individuals helping you make your appointment. What we've done is we've decentralized the appointment making, so now people call to a specific area for a specific provider, and there is now a team member that is manning those phones for that physician. And so the person answering the phone now is becoming familiar with the patients, is very familiar with the provider's daily schedule, and can be most helpful. What we've experienced in decentralized appointment making is we have increased the number of visits appointed. We've decreased by half the amount of time people wait on the phone to be answered, and we've also decreased by half the number of people that just gave up and hung up and then tried calling back later. So that's been a huge success. Something else that we've done that demonstrates our commitment to service is the amount of what we call outreach to other community hospitals in the area. Specifically, Dr. Leroy Hodges, one of our general surgeons, and Dr. Kim, another general surgeon, in fact, do cases at the Jackson Hospital to the west. Dr. Hodges goes to Wyndham and also has been going to Madelia. We also have extended Dr. Berthelsen to Jackson, and Dr. Hounshell, our podiatrist, does cases over in Jackson. So we're trying to reach out to the community surrounding us and offer services that maybe aren't otherwise available in those communities.
And I would imagine that's nice for patients that live in those communities. Yeah. They don't have to drive to Fairmont to see their physician.
Absolutely, absolutely. Some of the specialties are not available in those smaller communities, and so if we can drive to them, they can seek care in their local hometown and not have to travel. And of course, as we get closer to winter, that's always an interesting time of the year.
Well, I know community health education, you said it, it's something Dr. Vicolo has been very passionate about since he took over as president and CEO. And he was a driving force behind this Speaking of Health television show that folks are watching right now. Also, we have the radio program, the newspaper columns, and public presentations.
Well, Dr. Vicolo feels very passionately about healthcare is not simply treating sick people. It's actually extending ourselves into the communities and helping people keep themselves healthy. So with his leadership, we've put together the Speaking of Health series, both the TV show, the cable show, radio program, articles in the newspaper, and then hosting a monthly on-campus featured physician. It's open to the public, of course, at no charge, and we feel we're very much obliged, if not it is part of our mission, to keep the communities healthy and do that through education as well. Our board of directors, as we changed our mission, vision, and value statement this last summer, we had a serious conversation about that obligation to the community to give back. We can even weave in the debate on healthcare reform. Healthcare reform really starts with individuals taking care of themselves, and so we want to be there to help as well.
So we want to get folks healthy so that they don't have to go to the doctor, and so they're not so very sick before they ever get to the medical center, right?
Absolutely, absolutely. All the studies show that through preventive health measures and taking care of ourselves, we reduce utilization, therefore we reduce the cost of healthcare overall. And as far as the mission of the medical center, we want to be available for the significant needs of the community. So if someone is taking care of himself and not coming into the medical center, we're actually opening up access to others in need.
Well, Fairmont Medical Center had quite a few new faces walking around the halls in white coats this year. We had several new providers join the staff, putting the total number of providers at the medical center to more than 50 now in a number of different specialties. This is the most providers that Fairmont Medical Center has ever had, right?
We've enjoyed a fair amount of growth over the last several years in our provider staff, and in fact in our whole staff. If I think about just my 3 years here in the Fairmont community, when I arrived we had 680 employees, and now we have over 730. And that's an indication of the growth of healthcare in the community. Specifically in the provider staff, we've had some very nice additions over the last 12 months. I mentioned Dr. Hodges, who joined us a little over a year ago, and he has been practicing in the community and the surrounding area for some time, but now he's part of Fairmont Medical Center. Late last year, Dr. John Holstein, who has been practicing on our campus for many, many years as a urologist, he actually became part of the organization. And so people coming in to see Dr. Holstein may have seen or noticed a change in the signage, and that's because now he's part of the Fairmont Medical Center. Joining Dr. Holstein in urology is Dr. Christopher Gran, who joined us in this last 12 months. And Dr. Gran actually is a native of southern Minnesota, went to medical school at the University of Minnesota, and then moved off to Florida and apparently missed the winters. And so he has come back to join us at Fairmont Medical Center. This past summer, Dr. Tanya Kreilkamp joined us. Dr. Kreilkamp is a native of Elmore, Minnesota, with family still in the Blue Earth area, and she's a family physician who does OB as well. Also joining us this summer was Dr. Dan Wren. Dr. Wren staffs our emergency department. He comes to us from China and is very experienced in trauma medicine. Most recently, Dr. Eve Rogers, a neurologist, but she's also certified in sleep studies, so she can assess and diagnose those with sleep disorders. But she joined us, and she works just 3 days a week with us, but she's a great addition. And then recently we had 3 nurse practitioners join us. Adriana Jensen, who is a native of Sway City, April Pullman, who's from the Spirit Lake area, and most recently Tracy Henderson from the Emmitsburg, Iowa area. They've joined us as well. And we continue to recruit for family physicians, internal medicine physicians, general surgery, orthopedic surgery, and continue to supplement the staff with nurse practitioners, physician assistants.
Do you find that when it comes to recruiting providers that the small town feel, the Midwest, is appealing to a lot of them?
Very much so. Some people choose to live in a metro area, and that's their choice. But people that are responding to our opportunities already have it in mind that they want to be in a smaller community. Talk about Dr. Ren in particular. He grew up in a very, very large city in China, and when we invited his wife to visit as well, the response was, Fairmont is like a park. And they were here obviously in a green time of the season and so on, but truly thought of Fairmont as a nice community and not overwhelming. And so we do have a fair amount of people that seek us out because of the size of the community and what the community offers. It's fun. We had a physician here recently visiting us, and we make it a point, of course, to make sure they drive around the community, see the lakes, and see all there is to see in Fairmont and the surrounding areas. And people truly do respond to that.
Well, in 2009, Fairmont Medical Center received some very prestigious awards. Why don't you talk a little bit about those?
Well, there's two in particular I want to highlight. One was the Minnesota Hospital Association Safe Site Award. Now, this is the second year in a row that the Fairmont Medical Center has received an award from the Minnesota Hospital Association. Last year it was the Safe Falls Award. In essence, they awarded us or noted Fairmont Medical Center's efforts in putting into practice what is considered best practices, in this case, safe site surgery, making sure, of course, that we conduct surgery on the proper location, which it sounds like it's an obvious thing to do, but missteps can happen in healthcare, and what we are doing is making sure we're minimizing that opportunity by putting into place these best practices. The other one that's been a real treat this year is one of our employees, Jeannie Burhow, who is a housekeeper in our Lutzwing area, was cited as she was one of two Mayo Health System employees selected for their service in 2009. And there's 13,000 Mayo Health System employees, so she was one of two selected out of 13,000, rather significant. And what was really fun about this award is Jeannie was nominated by a coworker. Those nominations went to Mayo Clinic or Mayo Health System headquarters, as it were, and they had a panel that reviewed those nominations, and Jeannie was one of two people selected. And we had the opportunity to actually celebrate with Jeannie at a dinner in Rochester back a couple months ago. So we're very proud of Jeannie. Jeannie represents 730 employees who care about the patients.
So, Steve, what's ahead in 2010 for Fairmont Medical Center?
Well, Jason, we've been working on the foundation for the future as we go, if you will. And as I mentioned, the Board of Directors in 2009 reframed our vision, mission, and value statement. And our vision, I think, is very exciting because it's very expansive. And our vision is great people providing great care that leads to great quality of life for our community. And we're going to keep that vision out there in front of us as something we are working towards. As I mentioned earlier, our focus is on safety, quality, and service first. And we do that by bringing together 730 very committed, caring staff members. We continue to recruit, as I mentioned, for more providers. We're looking at opportunities to expand services in the community. And then we're also in 2010 going to be ramping up or getting prepared for electronic medical record that will be implemented in early 2011. Now, the community itself won't see many of those activities on the electronic medical record during 2010, but about a year from now, things are going to be radically changed relative to the record keeping. So lots of exciting things out there, and we look forward to a very, very successful year for Fairmont Medical Center and for the community.
Excellent. Well, that is all the time we have. We want to thank Steve Pribyl, Fairmont Medical Center Chief Administrative Officer, for joining us today on Speaking of Health, and happy holidays to you.
You too, Jason. Thank you.
Have a great day and be healthy.